Welcome to Chapter 15, Music and Health. I've added a video for you to watch, and it's a TED Talk from Csikszentmihalyi High on flow. And again, flow we were talking about in Chapter 12. But I thought this was a really interesting point to take, and again, more of a reinforcement of the contents of flow or the optimal experiences. While I won't assess you on it, I do hope that you will watch it and enjoy. So, when we talk about music and health, sometimes the association with that is music therapy. Now, again, for the music therapist in this class, it may not, these are the general terms that are discussed throughout the book. Now, in 1950, the creation of the National Association for Music Therapy was created. Michigan State was the first university to offer a music therapy degree. I believe that your book says the University of Michigan, and that is a typo in your book. So Michigan State was the first university to offer a music therapy program. Go Spartans, I guess, if that's what you want to say. Anyway, requirements for music therapists, ability to play a range of musical instruments. Again, they're not just there to do a therapy session of just talking with a patient. They're also singing with them. They also need to play numerous different instruments, maybe guitar, piano, ukulele. Again, even more than that. They need to have improvisational skills, again, to be able to work with the client. Maybe the client is changing tempos, or maybe they need to have some type of improvisational skills on maybe certain hymnals, or maybe popular music. Again, be able to improvise at a given notice. And they're also doing counseling and healthcare skills at the same time. Again, they're not just playing music and hoping that the patient or whoever they're working with is getting better. Again, they have to know about the counseling part of it, know how to assess their skills, and know what they need to be working on. And again, these are just three important topics, three important characteristics of a music therapist. But again, there's so much more than that. And there are different approaches of how music therapy works with clients. So, according to the American Music Therapy Association 2007, music therapy is the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. Again, if you ever get an ad for going to a music therapist, it's important to know that they are board certified. They have the MTBC after their name, the Music Therapy Board Certification, and that they've also gone to a good program. IPFW actually has a fantastic program, and there are probably about 70 majors in this department at this time. So there's receptive music therapy, meaning listening to music. Active music therapy involves the patient in creative participation, singing, playing an instrument. And again, a music therapist can do both of these, and they may take both of these approaches. The efforts of music on health can be analyzed over several levels, from cognitive functions to emotional experiences. Again, this is not every type of setting, but you can find a music therapist in hospitals, mental health and rehabilitation facilities, mental health clinics, drug and alcohol programs, nursing homes, correctional facilities, halfway houses, and schools. Again, there are probably other places where you can find music therapists. I went to the University of Kentucky, and the University of Kentucky Hospital hired a music therapist to give them a 3-year appointment to see how could a music therapist save the hospital money. And within 1 year, the hospital concluded that this one music therapist saved the hospital over $350,000. And so what did the hospital do? They ended up hiring 3 more music therapists. Again, different situations. Working with children, maybe there's certain procedures, maybe just doing an MRI machine with a child, and because sometimes you may have to put the child to sleep in order to not have maybe I guess in simple terms, maybe a breakdown in an MRI machine, or giving them a shot, or doing maybe just a simple procedure that doesn't really involve anesthesia for an adult. I'm sorry, to be put to sleep for a simple procedure for an adult, but they have to do it for children in order to operate and to be, safe. However, a music therapist can come in and save that anesthesia for a child, or have to be put under a sleep in certain type of situations, and that actually ends up saving the hospital money. So, looking at Alzheimer's disease and music therapists. Now, when we talk about Alzheimer's disease, it's a chronic neurodegenerative disease that usually starts slowly and gets worse over time. It is the cause of 60 to 70% of cases of dementia. If you've ever met anyone with Alzheimer's disease, you know that it's a gradual thing. And it does get worse over time, and then eventually, that's usually the cause of death of something related to the Alzheimer's disease, or something that was caused by the Alzheimer's disease. But again, they lose their memory, they lose, their awareness, and again, many other things. It's a neurodegenerative disease. So, but in music therapy studies, it's improved on a battery of standardized tests concerning social and emotional behaviors following music therapy sessions of patients with Alzheimer's disease. One study said after 4 weeks of music therapy intervention showed significant increases of melatonin, norepinephrine, and epinephrine. And I'm sorry if I did not pronounce those words correctly. So, autism. Again, this is something that has been, children are labeled these days. They're on the autism spectrum. We do not use, I cannot think of the word at this moment. But anyway, I'm sorry. You probably know, and you're screaming at the screen right now telling me what it is. But right now in the Psychological Association, we use the autism spectrum. High functioning and low performing, low functioning. And anyway, so patient was a 9-year-old, study did, a patient was a 9-year-old child with autism who worked with a music therapist for 2 years. At the beginning of these sessions, the speech was minimal. Behavioral was ritualistic and compulsive. After 2 years of music therapy sessions, learning all the letter names on the piano, he learned to read music and had progressed into a second piano instruction book. Moved from the hospital back home and was able to attend a special education first grade class. This is a lot. This is a lot for someone with autism, especially if they're on the low functioning autism spectrum. So really think about this as Asperger's. That's the word. Anyway, going back to autism, it's really interesting to see a music therapist is able to get a child with autism and they're able to maybe attend school for the first time, or maybe they're able to communicate better than they did when they first began. So, this is for my music therapy majors. What are some settings that you find music therapists and why? Can you talk about any of your experiences? And again, there's numerous settings that we've talked about: hospitals, schools, correctional facilities, mental hospitals. And again, it depends on the patient. It may be group settings, it may be individual, depending on what the patient needs. So, music medicine. Music medicine is defined through multidisciplinary scientific evaluation, including mathematical, physical, psychological, medical, psychological, and the other word should be physiological, musicological, and music therapeutic needs, as well as through preventative, curative, and rehabilitative application of musical stimuli in healthcare settings, in order to complement usual medical procedures while regarding specific pending or actual existing health disorders and their ordinary treatment on an individual basis. So, examples of music medicine include they're able to maybe control pain, reduce blood pressure, reduce heart rate, musical tension, chronic pain therapy, intensive care, geriatrics, behavioral disorders. Again, the list of using music as medicine can go for a long list of what it could be used to treat patients. Hearing health. Now, at the beginning of the semester, I did emphasize the importance of hearing health. One study found that exposure to loudness levels more than 85 decibels during an 8-hour period may be detrimental to the hearing acuity. Now, again, thinking about 85 decibels, it's not that loud. Probably a vacuum cleaner. But listening to that much exposure for 8 hours is really not good for your ear. Now, again, you're not going to vacuum your carpet for 8 hours unless, I'm not sure how, you do your cleaning, or how big your house or apartment is, but 8 hours is a very long time for vacuuming. But looking at university musicians for noise exposure, all students exceed 85 decibels and some reach levels of 94 decibels, which could give them only 1 hour of safe exposure. Now, looking at university musician students, we're talking about students who are, maybe they're in the band, maybe they're in the choir, maybe they're in the marching band. Some of these levels have reached very high decibel ratings levels, and it really can do damage to your hearing health. Vocal health. So when we talk about vocal health for singers, they're at risk of damaging their vocal mechanism. So when we talk about vocal health, we're talking about improper singing techniques, overuse of singing or your voice, yelling, speaking at low pitch levels, smoking, alcohol, drug use, dehydration, allergies, GERD, which acid reflux, and laryngitis. That's why if you usually see a singer, most likely they will have a bottle of water with them, and they're always taking vitamins, especially in this building. A lot of times singers may need to consult with a speech-language pathologist because maybe they're using their voice speaking wrong. And sometimes there are the singing voice specialists. But, sometimes people do speak in the wrong way, and the fact that they're using their vocal cords wrong. And a speech-language pathologist would fix that. Vaughan, 2007, surveyed middle school and high school choral singers. The majority of them engaged in harmful activities, such as yelling, constantly clearing the throats, stress, and performing of a wide range of styles. Again, this is so important. When you're using all of these or one of these overly, you're doing damage to your voice. So that's really a small, short synopsis of Chapter 15, Music and Health. Again, this is very important to musicians and maybe even to parents of maybe future musicians, so they understand the importance of health and and the importance of musician musicians being healthy, as far as staying hydrated, not listening to prolonged loud decibel levels. But it also talks about music therapy as well, and the importance of having a music therapist in all different types of settings.